the audience about some of the conditions inside jails and prisons during the COVID-19 pandemic, and the infections compared to the general population. I just want to sort of lay out some context for people if they don't recall what's been happening.
Yeah, absolutely. I think some of the two most pressing statistics to think about when we're talking about COVID behind bars is that the case rate is almost 4 to 5 times higher in prisons than it is in the general US population. So we're talking about more than double, like 4 to 5 times higher. That's huge. And the same thing is true of the mortality rate from COVID. So people in prisons are dying at 2 to 3 times higher rate than those who are outside of prison. So we're seeing sort of the effects of COVID that we are experiencing in the outside happening sort of in a microcosm under a magnifying glass, amplified in prisons and jails. So, that's been happening obviously since the beginning of last year. There's been, over 400,000 cases in prisons. There have also been over 100,000 cases among prison staff, and a couple hundred deaths of staff. So this is kind of something that's definitely still running rampant in prisons and jails across the country, and has been pretty catastrophic behind bars.
It's horrifying. And later on, we're going to play a part of the episode that you helped us out with, Emily, in the past about this. I'm wondering, so you went through some of these statistics that you found, and I'm wondering if you could talk a little bit about this disparity in vaccination policies and the harm specifically from not having a national standard.
Absolutely. So I think as we often see, policies across state lines and even across county lines within a state, so if we're talking about jails, those are county level, the policies are always very inconsistent and tend to differ on a lot of key elements, whether it's talking about getting the regular seasonal flu vaccine out, or if it's something more timely, like getting the COVID-19 vaccination out. So we've seen that only about 10 states had incarcerated people specifically identified as part of their first phase of the vaccine rollout. So all the other states either had it sort of ambiguously or in a later stage. And so, our thinking at Prison Policy is that if we're going to be vaccinating people early who are living in congregate housing, living in dense areas, unable to socially distance, like nursing homes or college dorms, then prisons and jails should certainly be up there in that first phase. So initially, we only saw about 10 states identifying them as in that first phase, whereas about 26 states offered vaccinations to corrections staff in the first phase, which I do think was a good plan. I think that they are certainly at high risk as well for working in these environments. But you can see sort of that disparity between like, oh, well, we'll vaccinate the staff and that will somehow create a barrier to protect the incarcerated people instead of us actually just offering them the vaccine early on. And that's something that's been really challenging to follow across the country because it's changing, it's evolving, which is good, but it's also hard to track. So, we are also seeing things sort of changing like this week. So in Cuyahoga County in Ohio, they initially had only 5% of the people in their jail were vaccinated. And just this week, they start to offer it to everybody in the jail. And we're talking about like mid-May now, almost everybody is eligible over the age of 12. So what are we doing just rolling that out? So yeah, those policies have not been very consistent or very structured.
Yeah, Emily, and you obviously mentioned how there's still so many more incarcerated people that need to get vaccinated. So can you just talk about sort of just like the built-in harm inside these institutions when it comes to infectious diseases, especially the coronavirus? Because experts have been warning about this from day one, that this was declared a pandemic, but we still let it fester inside many of these institutions. Can you just talk about just some of the inherent problems inside these places?
Absolutely. I think, there's two levels at which I think we can answer that. And the first is sort of historically, and thinking about historically, people in prison are tend to receive inadequate health care to begin with. They're generally in overcrowded facilities where medical staff don't have the time or the capacity to see everybody who's having a medical problem. And that was an issue long before COVID came on the scene. So that's kind of the environment that we've been walking into historically, as well as there have been numerous situations in which incarcerated people have been harmed by either like experimentation or medical testing inside of prisons. So we're looking at a population that's both being harmed by this and also suspicious of the medical system in the facilities that they're in. So then the other part of that is that looking at the people who are incarcerated, as a country, we tend to incarcerate people who are experiencing more chronic illnesses, so both physical and mental illnesses, than we see in the general population. So we've got a particularly vulnerable group of people behind bars in prisons and in jails. In prisons, we're seeing like asthma rates that are almost 2 times higher than in the general population. We're seeing HIV rates that are almost 3 times higher. Heart conditions are also 3 times higher in prisons and jails, and other risk factors, even like cigarette smoking or history of smoking, is much more prevalent among people who are in prison. So we've got kind of this constellation of health concerns that already exist in this population that are likely not being addressed. And then we're introducing a respiratory virus that's extremely contagious and extremely deadly. So the people that are in there are already at risk. And then they can't even participate in the things that we've sort of established as ways to protect yourself. Social distancing is just not going to be possible across the board in prisons or jails. We're talking about dormitory style housing. We're talking about beds that are 3 feet apart at best. We're talking about, one eating area in the cafeteria. So that's not happening. And then we're also seeing people struggling to get access to the things that they need. And this was something we saw earlier in the pandemic, but difficulty getting access to hand hygiene, rules about alcohol-based hand sanitizers, difficulty getting access to masks because it's a security risk or things like that. So all these things are playing into sort of barriers, I guess, to incarcerated people protecting themselves, but also, surviving this pandemic if they get the virus.
It's incredible. It's a total recipe for disaster, obviously. Emily, I want to go back to the prison guards, right, and the corrections officers, because at the beginning there was this sort of misguided, and obviously it's played out that way, misguided policy of let's vaccinate them, not worry about the prisoners, and that will sort of form some type of health buffer and protect everybody. So if you could just talk a little bit more about that sort of approach, what happened, and where are we at right now in terms of the vaccination rate among prison guards?
Yes. So I think that the initial ideas around vaccinating Department of Corrections staff, prison staff, medical staff, all of those people who are coming in and out of the facility, was based on a couple of factors that had already been sort of in play and then kind of faded out of play during the pandemic. So initially, a lot of states made a move to stop admissions to prison. So instead of letting new folks enter prison, they're kind of keeping them in county jails. So that created problems in county jails. But then you're seeing that in those prisons, the only people exiting and entering are the staff. And so they become sort of unintentionally the people who are carrying that risk of contagion. So once that happened, you can sort of see the logical leap to saying, oh, let's vaccinate the staff first. However, by the time we started vaccinating people, I think every prison system had resumed admissions. So we're no longer like, some confined population. The population is changing. There's people coming in, there's people going out, there's people coming back in. So that's no longer like a feasible plan. So when that changed, I think this vaccination rollout plan should have also changed in those states to say, okay, we need to vaccinate both the staff and the incarcerated folks at the same time. It's been interesting to look at the acceptance rates of the vaccine among correctional staff and also among the incarcerated population. So the median vaccination rate of prison staff across all the states that we could look at, which was about, I think, 36 states in the federal system for staff data, the median was about 48% of staff were receiving that first dose or the Johnson & Johnson 1 dose. So that's like below half. And for a population that we were initially considering to be some sort of protective wall between people behind bars and the general population, that's obviously not going to cut it. That's nowhere near herd immunity, and we don't even know what that's going to be for COVID. So it's just not even close. Some states like Michigan and Alabama have just over 10% of their prison staff vaccinated, and that's pretty frighteningly low. And there were only 4 states that had over 70% of their staff vaccinated. So again, that's good, but the fact that it's only 4 states is pretty frightening. So I think that plan sort of hasn't really played out very well, especially as we continue to see case rates kind of climbing among incarcerated people and impacting staff as well. And continued COVID deaths behind bars in states where, vaccinations have even started in prisons. People are still dying of this disease, which, we could really be reducing the number of people dying by COVID behind bars. We have that ability at this point.
Yeah, that's a good point, especially because people don't realize that this is a virtual death sentence for people who were potentially in prison for a few years or whatever the case may be. Emily, just quickly, the last question that I have is prison policy obviously did you guys did a report where you graded each state, and I think most states in the country received a failing grade. How has the vaccine rollout potentially impacted those calculations? I don't know if you've done anything like that yet, if you've updated that report, but I'm just wondering if that's part of your calculation going forward.
Yeah, we haven't updated that report where we sort of divvied out those scores based on how folks in these states were responding to COVID in prison. So we looked at both population reduction as well as some other efforts like getting out PPE, personal protective equipment to staff and incarcerated people, and all sorts of other, criteria that we put into that. I would expect that everybody would score a little bit higher if we kept those same criteria, because things like getting out masks have become a lot more accessible than they were back over the summer. But I think we would have to, as you suggested, incorporate the vaccine rollout. And given the fact that we're still looking at just about half of the incarcerated population is vaccinated, which is, again, a good thing. We're talking about a rate of vaccination that's very similar to the general U.S. population, but to remember that this is a population that is particularly at risk for severe complications from COVID. So you can say, yes, that 50%, 55% is similar to the general U.S. population, but it's still really, really, really dangerous behind bars. There's no socially isolating in your apartment because you're not vaccinated. You can't. You're in prison. So I think if we were to incorporate that, we would have to weigh that a little bit more heavily than some of the other criteria at this point. And I would expect that most states are still doing pretty poorly in addressing this. I mean, it's a population that legislators and officials are often forgetting and often overlooking on purpose. So it's almost impossible to see prisons and jails addressing this in the way that has been recommended by policymakers and and lawyers and attorneys and all those folks on the ground doing the work, and the people behind bars advocating for themselves. So they're just not listening to that.
And I think if anybody's watching, as opposed to the podcast, you can see that New York State has 27% vaccination rate, and New York was mandated by the court to perform vaccinations. It wasn't even a policy by legislators or the governor. So definitely important information from Emily. Emily, once again, we always appreciate your time, and I just recommend everybody check out Prison Policy. Sign up for the newsletter, because as a journalist, it's a great resource to have, but also just for the general public, just to stay informed. I definitely suggest you do that. Emily, once again, thank you so much for coming on the show.
One time before we go, Emily,
sure.
Manny, thank you for that in-depth breakdown. Obviously, your work is super important, noble, and worthy. One thing, I'm going to take it down to a real everyday person kind of level. Some of us have loved ones that are in prison, right? We have friends, family members. And we know, because from dispatches from the field, as it were, that these conditions exist and that these problems still exist, that the vaccinations haven't rolled out to everybody. I know it seems daunting for a family member or the everyday person to help affect the change. When you said lawyers, policymakers, advocates, organizations are all doing the work to try to make these things better. What can the everyday person, the family member, the regular constituent do to try to affect the changes that are necessary to help our incarcerated population, our friends, families, and neighbors?
Yeah, I think that's a great question. I think as I normally do, have two answers to that. One is sort of on an individual level. I would really encourage folks who have access to a lot of information about vaccines and the risks and benefits of it, and what it actually entails and all of that. I would really encourage those folks to talk to their loved ones behind bars, because the reality is it's very hard to imagine that public health education is a priority in prisons and jails. We've been hearing stories from people behind bars that there's sometimes a flyer about the J&J vaccine on a table, and then they're asked if they want it, and they say no because they don't know anything about it, or they watched one news episode where it talked about the risks of it. So there's no consistent education. So that would be sort of one thing I would offer as sort of a tangible kind of quick step, would be to just kind of offer some education however you can, whether it's a phone call or an email, or if there's visitation available, to do it that way. I would sort of, on a bigger scale, I think that's where it's a little less tangible to think about what kind of changes we can make. I would say that there are a lot of sort of grassroots organizations doing this work in tandem with sort of incarcerated activists about what they specifically need. And I think that varies depending on the facility, depending on the state, depending on where they are with their vaccine rollout. Like I said, there's some states that have done a pretty good job getting vaccines available. So they're going to be having different issues than, say, Utah, that has 7% of their incarcerated population vaccinated. So I would encourage folks who are looking to help their loved ones, their friends and family, to reach out to those local prison rights organizations to see kind of what it is that they're asking for on the ground and how we can sort of support that, whether that's, sending a letter to the warden or sending a letter to the sheriff, or if it's something bigger than that, then, they'll be aware of that on the ground. But I think it's the same thing with the policies. It's so disparate between places that it's hard to know from like a national perspective where to kind of insert ourselves to help support, the people we care about.
No, that's valuable information. I appreciate that. Thank you, Emily.
Thank you guys for having me.
Thank you.
Emily, take care. Thank you so much.